Good morning to our viewers on Facebook and those viewing us live on TikTok. I'm Nikisha Burchell, the Deputy General Secretary of the People's National Party and Information and Public Communications spokesperson for the opposition. Thank you so much to the members of the media who are here with us this morning for not just another press conference, but for an SOS alert for a national attention to be pointed at our health sector. Our public health system is in crisis, and the lives of ordinary Jamaicans are being placed at risk because of neglect, delay, and misplaced priorities. Our spokesperson for health and public wellness, Dr. Dawes, will speak to you about what's happening at the Kingston Public Hospital, a hospital that is itself sick. Jesse James Clark, our junior spokesperson on health, will speak to you about troubling issues related to water quality affecting communities across Kingston and St. Andrew. Remember, when Jesse sounded the alarm and the government said it was not true? We have the evidence today. In the face of public health crisis and collapse, is the ministry's real priority to safeguard the lives of the Jamaican citizens? Where is the Minister of Health in all of this? Is he at sea searching for replacements for the Cuban doctors whose terms have expired? The People's National Party is raising these questions not to score points, but to demand answers for the sake of every Jamaican who deserves proper health care and clean, safe water. After all, we are the land of wood and water. Over to you, Jesse James Clark, to speak to them about the water quality.
Good morning, everyone. My name is Jesse James Clark, and I'm the Junior Shadow Spokesperson for Health and Wellness. I'm also the chair for the Public Health and Sanitation Committee for Kingston and St. Andrew. No concerns were raised to us in our committee meetings about the quality of water in sections of Kingston and St. Andrew. And that is what prompted us to do a tour of several water treatment facilities in both in the corporate area and in the rural and some of the rural water treatment sites. We have seen results that are quite alarming, and we brought it to the public because we felt that not much was being done to make the public aware of the risk that they were being exposed to. After I brought these results to the public, I was accused of bringing false information and telling lies. However, I just want to highlight the results that we have here today that are projected on your screen. And I want to point to you first, look at this graph. What the bar chart, what is it showing? Is showing what the levels of coliforms should be. And just for everyone, coliforms, these are organisms, bacteria, aka germs, that are found in feces and also found in soil. And they are indication of the quality of our water supply. Now, the red line going across the bar charts running from your left to right, this is what the standard should be. So you should not have any of your coliform limits going above this 5% that you see that red line is connected to. However, if you realize for Kingston and St. Andrew, they are right at 5, and the yellow bars indicate distribution. So that means after the water have left the plant in your pipes, that's what it is. And this is suggesting in this case that there's something happening along the line after the water has been treated, because before it's okay. However, when you look at what is happening in our rural water treatment sites, it's very clear, as you can see from the graph, and this is NWC's results, by the way, that you have at source, which is that blue bar, it's almost 5 times the allowable limit. So you have 5 times the amount of germs that should be in the water presently. And these are coliforms, which means that you have very bad water quality after the water was treated. Because at source, this is at the plant when they have brought the water through their treatment process and tested it to see if the treatment process had worked. And you see that it's way above the allowable limit. And knowing this, the water was still distributed. And you have in distribution where it's almost 3 times the allowable limit, where it's at 17 in the yellow bar. for the rural communities. Now, this is not just a one-off situation for the month of February. For the rural areas especially, this has been consistent. And we understand why you'll have this consistent bad result or poor water quality coming out in the rural areas after our visit. The water treatment, we're not saying that you'll be able to do all the steps that you do at your major water treatment facilities, like a Constant Spring. But even in rural areas, you still have to take some measures to ensure that the water is safe for consumption. So for example, at your regular water treatment site, the water goes through several processes. For example, it goes through flocculation, which is where they add chemicals to bind with those fine particles that might be in the water, so that they can become heavier and settle out. You have sedimentation, which is where the heavier dirt particles settle and the water is basically clarifying the water to make it clear. And then that sedimentation the clear water is removed. It is filtered. And it passes through several different filters, whether it's sand of different size filters to ensure that they remove any residual viruses, organisms that might be left back in the water. And then it moves from there to disinfection, where you have your chlorination taking place. However, in the rural areas, we're not saying that you have to do all these steps. However, filtration is a must. And this is one of the infrastructure upgrades that has to take place at our rural water treatment sites to ensure that the water is safe. Also, we're recommending that they install temporarily, they can use black tanks, or what we Jamaicans call black tanks or water tanks, and temporarily to have holding areas for the water in the rural areas so it has enough contact time with the chlorine before it's distributed. You cannot be getting results that shows that you are having poor water quality at source and you're still distributing it to the public. Another major concern for us is how the Ministry of Health came out and said that the environmental division in the Ministry of Health, they came out and said that the water was safe for consumption in Kingston and St. Andrew. But at the same time, the NWC is producing results to show that it is not safe. So I'm now saying to the Ministry of Health that you need to get your house in order, and we need some accountability as to why you were saying that the water is safe when NWC is saying that the water isn't. NWC has also since then admitted that they're having challenges in the rural areas. And they have also admitted 6 days ago on their Instagram page that they have found samples positive for fecal coliforms. And they said that when they have instances of that happening, they will flush the line and they'll cut off water supply. And I'm asking the persons in the rural Jamaica if that happened. And we want them to now come and apologize for their misleading information that they have been given to the public and for trickling out the truth bit by bit. I'm also asking the journalists present here with us today for you to do your own fact-finding mission and get the results from the NWC, but not only get the results, I want you to visit these rural water treatment sites and let them show you the process of treatment that the water goes through, and you tell me if it's up to standard. Or the minister with the responsibility for water, and also the Minister of Health needs to come out and ensure that we are getting, the steps are in place to ensure that we get good quality water in Kingston and St. Andrew. Also, we'd also want to make the recommendation to the National Water Commission, similar to how we get the results from Petrojam about the pricing of fuel each week. We'd want them to publish their results. And if they're having issues in any particular area, they need to let the residents know the areas that will be affected by the poor quality water and what has been done to correct those measures, and when it is safe again for the residents in these areas to consume the water that is being released. We have no issues with the staff at the National Water Commission, because after my visit and tour too as well, I understand you have a very difficult job and that you're given basket to carry water most times. So I'm also advocating for the staff at the NWC to receive the necessary gears, compensation, and resources to ensure that they can get to these remote sites and collect the samples, and to also upgrade these sites so that they can do their job properly. They cannot do what they don't have the resources to do. So the minister and the Ministry of Health needs to be the one that is overseeing the NWC and protecting us, the consumers, and to ensure that they stick to the standards that are there for them to be, for the water that is being produced by NWC. So once again, I just want to point out the inconsistencies between the results coming from NWC and the results coming from the Ministry of Health, the environmental unit, and they need to answer to the public and to Jamaica at large for that. And we need the NWC to come out, and anywhere else on the island, don't wait on us, or don't wait on us to come out and to say it. You come out and tell us all the other areas on the island that you're having water quality issues and what is being done to address it. In this case, we understand you have to do some infrastructure upgrade, or the results from your rural water treatment sites, they will not improve, and filtration is a big step. Thank you very much.
Good morning. I'm Dr. Alfred Dawes, the shadow spokesman on health and wellness, just over a year now for the People's National Party. During that time, I have been highlighting what I saw as an impending crisis, or an existing crisis that was getting worse in the healthcare sector. To be honest, myself and my team, we did not know that things were this bad. Whereas we warned of a collapse, we didn't know that the system was actually collapsing in front of our very eyes. The latest storm or hurricane to hit the healthcare sector is the mold crisis at the Kingston Public Hospital. Now, as far back as last year, October, November, there were concerns about mold in the clinics. A study was done, and because of the JLP's response every time we make a claim to attack us and call us liars and purveyors of misinformation, we are making the report publicly available so that Jamaicans can see for themselves that an independent subject matter expert has confirmed that there is a mold crisis at the Kingston Public Hospital. They have moved out the clinics from that area, downscaled the size of the clinics and house them in a separate room, but the problem still exists. The pitch patch work that took place at Cornwall Regional Hospital when that mold crisis first came to light about 9 years ago is the same sort of work that is taking place at KPH today. On top of that, there was a recent expose of the operating theaters not being functional because of the air conditioning units not working well. This was downplayed, but we did see that the 4 operating theaters are shut down now at the Kingston Public Hospital. And what has happened is that in that moist environment, mold is growing in the operating theaters. Again, this is being downplayed as something that can be fixed. But we know the track record looking back at what happened at Cornwall Regional Hospital, and we are very fearful that the same thing is going to happen at KPH again. We as a nation cannot afford for that to happen. We have 2 Type A hospitals serving Jamaicans in the public healthcare system. Cornwall Regional Hospital is basically non-functional. Kingston Public Hospital has been the only Type A hospital in the public sector that has been carrying the brunt of all of the trauma, all of the specialist care across the island while serving the needs of the Kingston metropolitan region. Now, with KPH being downsized, it is a crisis affecting not just Kingstonians, but Jamaicans right across the island. Surgeries have been cut, understandably, because you don't have an operating theater. They're on emergency surgeries and dire emergency surgeries only. Dire emergency means that you're going to die. And so you have to rush the patient to theater. If you have an emergency and you're not going to die immediately, then you wait until you become a dire emergency. Unfortunately, there are people who are patients who are admitted at KPH now who will never make it to an operating room. They unfortunately are going to die waiting to receive service. They have tried to outsource some of the more urgent cases, cancer cases, the University Hospital. It has been a logistical nightmare. They're not getting half as many cases as they would have done. They're trying to do some at Bustamante Hospital in another piecemeal approach, but there is no coordinated plan to see how you're going to get surgical services up and running. There are some crucial surgical disciplines that we cannot afford to fall off completely. One such service is neurosurgery. With Cornwall Regional Hospital not having a fully functional neurosurgical service, we're left with just KPH. And now KPH does not have a functioning neurosurgical service, which means that if anyone anywhere in Jamaica gets a fall or any head injury, they are in serious danger of dying from something that could have easily been fixed with surgery. Do not feel that the university hospital can shoulder the brunt of all of the trauma, all of the complex cases that are currently being sent for their management. They cannot. One type A hospital in the entire Jamaica cannot serve a population of almost 3 million persons who are getting older, who have chronic diseases and get a lot of strokes, heart attacks, and we do have a high rate of motor vehicle accidents as well as violent trauma. So when you put all of those factors together, taking out Cornwall Regional out of the public healthcare sector, and now taking out KPH as well, we are in a serious crisis mode. We cannot pretend as if it is business as usual. We cannot paint up a building and say that renovations are taking place. We cannot say that this was something that was inherited. We have to take decisive actions now. Again, other services that are affected, the ICU. When we spoke about ICU spaces and ventilators, the pushback was that it was simply not true. But the evidence came out from their own audits that we were lacking ICU spaces. Now, back then, a year ago, the ICU spaces at KPH contributed at least 7 total number to the bed count. Today, we're down to about 4 because the ICUs are non-functional, so they've moved them over to the Victoria Jubilee Hospital. So when you look at the whole picture, we are seeing a non-functional type A hospital, which was the last of the 2 that were supposed to serve the entire island. And with KPH out, we are in serious danger. Please do not get sick. Drive carefully, because you cannot be guaranteed that you will get adequate medical services. Now, there are some pictures that show the molds, growth in the ceilings, and there are some pictures that show what is known as a petri dish, those round dishes that actually show the different colonies of the mold. And you can see that these are visual depictions of high levels of fungus in the areas that were swabbed. And the averages are way out of what would have been expected. Patients cannot be seen and treated in these areas. There are a lot of issues that come with mold inhalation, and the staff are at serious risk. And anyone who has worked at Cornwall Regional can tell you that working in a mold-infested environment does cause respiratory problems. You just feel sick all the time, and it may aggravate some chronic diseases. So we're putting patients and staff at risk while this cover-up is going on. Remember that this was a report that was handed over to the team at the Ministry of Health from as far back as November last year. I say all of this to say simply that the current administration cannot be trusted any longer to manage the affairs of the Jamaicans and their healthcare system. The response, as Jesse had said, is that you first attack the messenger. You try to cast doubt on whether or not they are speaking the truth. And this is why we are making all of our data public. There are some data, some information that was said to me in strictest confidentiality because of the fear of victimization. But more and more people are speaking out. You attack the messenger, you attack their character, and you get your subordinates and your surrogates to do so. So on social media, you expect to have a barrage of insults and Quite frankly, I've gotten used to it now. But, I have just one thing to say to all of those persons who they're using on social media to attack those very persons who are trying to help you. They don't care about you. When I was in the public health sector at various levels, I would get a call from politicians to look after or look out for a prominent businessman or a party worker. I would never get a call to look out for a social media warrior. If you, unfortunately, are a victim of ill health and you seek services at the health center or the hospital, you will not be getting any favorable treatment because a politician is asking anybody. They don't care about you. So while you're there fighting amongst yourselves, it's allowing them to continue the rape of the system. And why I say they're raping the system, I have to bring up again, a drill was bought at the Bustamante Hospital for Children for $30 million. That drill can be sourced on the open market for $5 million. We have to ask, why is it that a government that is so concerned about taxpayer dollars is paying $30 million for a drill that can be bought for $5 million? These are the questions that we should be asking instead of fighting each other. The other thing that we have to address is the current minister's predilection towards shifting blame. It is never his fault, and it is always the fault of multiple administrations not maintaining aging infrastructure and equipment. But Mr. Minister, there's a difference between fault and responsibility. If somebody leaves a baby on my doorstep, it's not my fault, but it is my responsibility to make sure that that child is taken care of and given over to the appropriate authorities. It may not be your fault, but it is your responsibility to fix the healthcare sector because you are the one in charge. So deflecting responsibility from addressing adequately the source of the problem in a meaningful way by saying it is not your fault, we are just no longer going to accept that, and we're going to be calling you out on that, should you try to do so in this occasion. And the other deflection is usually that blame is cast at the feet of the senior managers of the facilities. And I want to speak to all the senior managers out there, because when I'm doing my hospital tours, I'm always taken to the newly renovated sections. The bypassed areas are the ones that are overcrowded. When you speak to the groundsmen, the cleaning ladies, they'll tell you the true picture of what is happening at the different health facilities. But we have this tendency to put out the potted plants and move the patients out of the corridors when you hear that a spokesperson or a minister is visiting. You need to stop that now, because what that is allowing those who continue to pillage the system to do is to make it seem as if everything is fine and they're doing a great job while things are falling apart. And then when things are obviously falling apart, they will throw you under the bus. And may I remind you of that was what exactly happened at Bustamante Hospital when it was said that it was the managers and the doctors who were trying to hold up the system who did not alert the powers that be of what was really taking place. So take sleep, mark death, and please desist from trying to aid in any cover-up and trying to make things look rosy, because it is obvious to every well-thinking Jamaican who is not blinded by political lenses that things are falling apart and they're only getting worse under this management. The question was asked, where is the minister at this time? Not sure where he is currently, but we do know that Jamaicans will be presented with a $3.3 million plane ticket bill for the trips. The April Fool joke is that he left Jamaica economy class and he's coming back to Jamaica via economy class, but then all other legs are business class, amounting to over $3.3 million at a time when we still have mothers crying for their children to be able to get a CT scan after a motor vehicle accident. Priorities, my fellow Jamaicans. priorities. And with that, I close off. And I wish you all the best because, as I had mentioned before, we are in a crisis and there's no guarantee that you can get adequate medical care at any hospital, because if they have to transfer you to KPH, it is a problem. God go with you all.
Thank you very much, Dr. Dawes and Councillor Jesse James Clark. Now, if you are in the room and you have a question for either of the speakers this morning, please indicate by raising your hand. When you get the mic, please say your name and the media house you represent. If you're online on Zoom, please use the raised hand icon to indicate that you have a question, or place your question in the chat and we will present it to the speakers for you.
Hi, good morning. My name is Sashana Small. I'm a reporter at the Glino. I have questions for both of you. Jesse, as it relates to the graph that you showed that exposed, that showed the contamination in our water, the 5% in the Kingston and St. Andrew area, is that figure representative of all of Kingston and St. Andrew, or is it specific to a particular plant, water treatment plant? You could, you're saying essentially that the water that we're drinking is unsafe. If you could, can you explain to us, what are some of the risks in drinking water with coliform?
All right. Thank you for your question. So just I don't know if you're able to project the chart. So the chart is being projected again. So what we're seeing, as you see the bars, the purple bar, that indicates for this at the source, that's where the water treatment is taking place. So after I've treated the water, they test the water to see if the treatment has worked. And the yellow bar is in distribution, that means at your pipes. So what we are saying is that in Kingston and St. Andrew, in some sections, especially your rural areas, so for example, persons who are served from the Griffin Water Treatment Plant, Susie Spring, Belborough, Bowden, those areas, and there are other water treatment plants in rural areas that are affected, they will be getting this, they would have been getting this contaminated water. Now, the NWC, in their admission, after they admitted finally that they were having challenges, they have said that they have done flushing of the lines and so on to make the water safe for consumption for these residents. However, based on my visit to some of these sites, I know that more needs to be done in order for you not to have these results, to get these results back into the normal range. So that 5% coliform you see running across the line going across, that's the standard. So anything above that is we're having issues, and you can see for the rural areas it's significantly above, and for your distribution for Kingston, St. Andrew, meaning urban centers, it's right at the borderline. So you asked about the coliforms. So the coliforms, these are organisms that are present in the intestines of warm-blooded animals, and also they're found in soil. So they're used as an indication of the quality of your water. So if you're having high levels of coliforms, so these are bacteria or germs in the water. Having high levels, it means that your treatment isn't working or your water supply is contaminated. So something is happening along the line that is causing these high numbers. And as you can see at source, for some of your rural treatment plants, they are at 23 when the limit, the allowable limit is 5. So what you could have happening is persons being exposed. So when you have high levels of coliform, it don't only mean that it's only coliforms present in the water, because they are indicator organisms. It means that they could have viruses in the water too as well, parasites in the water too as well. And as you know, parasites can damage the organs, they can damage the intestines. Viruses can cause diarrhea, vomiting, illnesses like that. What you have happening, what has been saving us for the most part, especially persons in the rural areas, is that a lot of persons who can afford it, they buy water. That is part of the thing that has been happening, but it's not, that doesn't guarantee your safety. Because when you have contaminated water in one area, you do not know where that water will end up. Because why I'm saying that is that people catch that water and then transport it to other areas. They use it for cooking in other areas. And when you buy water from water trucks, some of them, they go to these rural areas that are not as heavily monitored to get the water from the line. And then they come and sell it to different areas, even some water shops too as well. So what you have happening, once you have them putting out water that is not safe, that don't meet their own standards, it means that you are putting the entire population at risk. And sometimes when people get sick, they don't believe that is probably coming from the water. They probably attribute it to other source because they're expecting high quality water that should be coming from the pipe. But what we are saying is that if your own results are showing that it's not meeting the standards, you need to do something to not expose the public to this.
I have a question as well for Dr. Dawes. Dr. Dawes, the report that you cited was done last year, and I've spoken to the administration at KPH, and they said that since that assessment was done, steps were taken to address the mole in those areas that you highlighted, the urology areas and so forth. Are you disputing this?
Anybody can say that they're taking steps. Well, what sort of steps? If they're definitive steps, then there shouldn't be any problem at all for the clinics to be moved back into the areas that they have taken steps to address. They can't. The clinics are held in another area, and they have partitions and less rooms than before because it is still not rectified. And this is the same thing I was speaking about before. The administrations of the institutions need to stop covering up for the policymakers at the Ministry of Health. If they continue to do so, then they're going to be thrown under the bus and we'll never solve the problems. So to make a vague statement like steps were taken, it is not telling the truth. It is specious. It may seem like they were addressing it, but it is not being addressed. It has not adequately been addressed. And if we continue along this path, we're going to get Cornwall 2.0.
Thank you. We recognize Jason Cross online from the Jamaica Observer. Please unmute and go ahead with your question.
Hi, morning, everyone. Hi, Nikisha. Dr. Dawes, over what period did those overseas trips happen? And based on the information that you have, where did the minister go?
Well, from now on, I've made a commitment not to share or say anything publicly without having my receipts. And I literally have my receipts right here, and we can make them the redacted itinerary available to the public that shows that the business class tickets, they are over $3.3 million with the only economy legs in and out of Jamaica. So that can be made available for your perusal. As to why he's there and why he is traveling, that can be ascertained from the Ministry of Health.
Do you have a follow-up, Jason? Another question for you, Dr. Dawes. Are you satisfied with the government's response with the Cuban doctors and their relationship with Jamaica?
Again, it was a nebulous response, and we are still left with no clear answer as to what is happening. So it has been the norm for several outgoing prime ministers in the Caribbean to speak definitively on where they stand with respect to the Cuban medical program. I think it's only fitting that our own outgoing prime minister speaks about it definitively.
Another question here says, any update on the billions of dollars unaccounted for at the Ministry of Health?
Well, they have a deadline. I believe it's either, I think it's May. I don't know where they are with respect to that. Again, the response was that it spans administrations, not accepting any fault or responsibility to say that, after 9 years, you could have caught up with what the other administration left and not add to that backlog. But it's the modus operandi that we have to deal with. We just hope that we can get some fulsome answers, because there are some serious questions that need to be asked about the spending of taxpayer dollars at the Ministry of Health. And I think nothing short of a fulsome audit of some projects would be warranted when we assume office.
There's a question for Councillor Jesse James. What's your message to residents of Kingston and St. Andrew? Should they be drinking water from their pipes today?
Right, so my message based on the response from until NWC comes out and share the results, and also tell us the infrastructure work that was done to improve the water treatment process in a lot of these facilities. They should definitely, I recommend they should always boil the water before you drink it. And I know a lot of persons use household filters. Those are also helpful to as well to get some of the contaminants out of your pipe. And you see the evidence too. When you're changing those filters, you see what is left back in them too as well. So, and wherever you are, not only in Kingston, St. Andrew, but on the island, and you're getting any indications of poor water quality, to report it. And we want all the municipalities across the island to pay attention to the reports that are coming in from both NWC and the Ministry of Health, and to question where these samples were taken and when they were taken.
Yeah, just one other thing that I didn't touch on. Cancer care. We are facing a cancer crisis. Much better. We are currently facing a cancer crisis. If you look at the Kingston Public Hospital that does a lot of the cancers, because they cannot get CAT scans and MRIs to properly stage the diseases and work up patients, even get proper investigations like colonoscopies to diagnose the cancers at an earlier stage, we're seeing far more advanced cancers being presented, and the outcomes are a lot worse. Since they stopped the outsourcing of diagnostic equipment, the government stopped paying for it. A lot of people who cannot afford these diagnostic equipment simply cannot get them. And so they have to wait for inordinately long periods of time to come up with the funds before they can get these scans, and that delays definitive treatment. It simply means that if you are poor and cannot afford to pay for private diagnostics right now, you are far worse than somebody who can call in a favor or find the money to pay for such diagnostics. It has reached even the point where simple hernias, we're not operating on simple hernias, we're operating on hernias when they get complicated and present as an emergency. This is just showing you how bad things are, because these are the conditions that, if treated in a timely manner, would never get to the stage where there are an emergency. But we are facing a cancer crisis in Jamaica, and the numbers are telling us the true picture.
Thank you very much, Dr. Dawes and Councillor Jesse James. Jason Cross asked earlier, where is the Minister of Health at this time? And as Dr. Dawes outlined to you, we have a copy of his particulars. It's not our practice to make these public, but we believe in transparency and accountability. And we know the Minister of Public Relations, the Minister of Public Health and Wellness, Mr. Tufton, will come to the public with his own spin on this. What has been brought to our attention is that he's somewhere in Asia, somewhere in India, Dubai, Manila, Hong Kong, Delhi, New York, somewhere along that trip. Doing what? We don't know. Could it be that he's searching for replacements for the Cuban doctors who've served Jamaica well over the multiple years? Could it be that he's on a personal trip? We are not sure. We also do not know if it is a taxpayer that is paying for this $3.3 million trip, but we hope that when he gets back home safely, he will alert the country as to the nature of his trip. What we've heard here today confirms what Jamaica already knows. Our healthcare system is stretched to a breaking point, and the government is not moving apace with urgency or the focus that the moment requires. With operating rooms shut, wards compromised, and basic medical tools out of reach, can we honestly say that an expensive trip overseas right now should be the priority of the minister and the leadership at the Ministry of Health? These are questions of priorities, of leadership and responsibility to the Jamaican people. The People's National Party is demanding more than just acknowledgement. We're demanding action. Immediate remediation at the KPH, independent testing, and full transparency around hospital safety. We want strengthened systems to ensure our water supply meets acceptable standards. Is that too much to ask for? And clear accountability from the Ministry of Health on how funds are being spent. This is about the people. It's about ensuring that every Jamaican, regardless of status, has access to safe water, decent healthcare, and leaders who put Jamaicans first. This has been a press conference from the People's National Party, and we will continue to hold this government accountable, even if we have to drag them there. Do enjoy the rest of your day.